Back with another video. This one's going to be on gas exchange. Now I'll draw your attention up here to the upper right hand corner. If you see, this is actually gills of a fish, which are its respiratory organs, and these gills are thin, flat segments that have really high surface area, which are very efficient for exchanging carbon dioxide and oxygen. Now we talk about respiratory surfaces. Basically what respiratory systems are for is to exchange carbon dioxide for oxygen. And they usually do this by a process of diffusion, just moving from an area of high concentration to an area of low concentration. And the rate of diffusion is very proportional to the surface area. The more surface area you have, the more diffusion that you have occur, the more respiration you have occur. Therefore, a lot of times respiratory systems are very flat and they're very large and thin. Now, some animals actually respire through their skin, but realize they have to go back to this moist surface. They have to keep their skin moist, such as the earthworms down here in the corner. Now, there's a lot of different ways in which animals can respire. They can use gills or trachea or lungs, but no matter what they use, there's still some general premises. They exchange carbon dioxide and oxygen. They are proportional to the surface area, and they must stay moist, and they occur by diffusion. Now, when we talk about airflow in mammals, there's a certain step that it takes. It goes through our nostrils into our mouth, then our pharynx, our trachea, then into the bronchi, bronchioles, and alveoli. Now, I want to focus in on the last three. I actually have a picture on the right-hand side over here of the bronchi, bronchioles, and the alveoli. The bronchi is like the big branch of a tree. I mean, it kind of looks like an upside-down tree. It's like the big trunk of a tree. The bronchioles are the tiny little branches, and then the alveoli are the leaves at the end of the branches. Now, inside of us, you have a bronchi that branches off into, there's two branches, one to the right lung, one to the left lung, and then that branches off into the bronchioles, and the bronchioles branch off into the alveoli. The alveoli are single cell layered sacs, and this is where actual gas exchange occurs. A lot of capillaries fill the alveoli. You may even have ruptured some before these capillaries whenever you cough profusely for a long amount of time. If you ever had blood in your mouth, that's probably where it came from. But they're very thin and fragile, and this is where carbon dioxide and oxygen go back and forth, is across the alveoli. Now, when we talk about breathing, there are two main ways in which breathing can occur. Positive pressure breathing, in which occurs in amphibians, and this is basically a pushing of air into the body. It's like you sucking air in, is how positive pressure breathing is. It's amphibians, you can see it as a picture, is like a frog. It will actually open its mouth, air will go into its mouth, it will close the mouth and force the air down into its lungs. That's positive pressure breathing. That is not like us. We actually do negative pressure breathing, in which air is actually pulled into our lungs by the movement of a thing called a diaphragm. A diaphragm is the thin muscle that underlines your breast cavity, your chest cavity. Now, this diaphragm, the muscle is kind of unique, in which that when it contracts, it actually flattens. Most muscles, when they contract, like your bicep, get smaller. Your diaphragm, when it contracts, it gets longer. It flattens. So when your diaphragm contracts, it falls downward, and it creates a bigger area inside your chest, which means it has lower pressure than outside, so air rushes in from high to low, outside to in. And then when the diaphragm relaxes, it actually condenses or gets smaller. It goes up into your chest, causing the cavity to become smaller, creating a higher pressure inside your lungs, causing air to be forced out. Now, the medulla oblongata, which is found at the base of your brain, is actually controlling of the breathing rate and your heart rate too. So the circulatory system we referred to in the last video, and the respiratory system is controlled by the medulla oblongata. Probably most famous from the water boy. But the medulla oblongata does control it, and it actually measures the amount of carbon dioxide in your blood. Now, a lot of people think that the amount of oxygen controls your breathing, but that's not true. The amount of carbon dioxide in your blood is what controls your breathing rate. As it goes up, your body realizes it has to eliminate it, and it causes you to breathe a little bit harder. Now, I end with a link between the circulatory system and the respiratory system, which is the blood. The blood carries respiratory pigments. Hemoglobin is one of those, which causes it to be able to carry oxygen more readily. Hemoglobin increases the amount of oxygen that can be carried, so hemoglobin is a good thing for us. All right, so the components of the blood, there are basically several components of the blood I need to mention real briefly, and the first one is plasma. Now, plasma is the watery part of blood, about 90% water, and the plasma I kind of think of as a river, and you talk about all the boats would be the cells, so if you compare the river to blood, then the river would be the plasma, and all the boats in the river would be the blood cells. So if we look at the blood cells next, erythrocytes are red blood cells. Erythrocytes, you do need to know the formal names, by the way. Erythrocytes, they are responsible for transporting oxygen because they carry hemoglobin. And they carry hemoglobin because they're shaped. They're actually like donuts with indentions. That's where the hemoglobin rides. So they're made especially for it. There's form, fit, function again. Leukocytes are the white blood cells. They're involved in the immune system. They're actually what is involved with killing anything that may come in that's foreign. And then you have platelets. Now, platelets are involved with clotting. So when I cut my arm, what causes my blood to stop bleeding out of my body is this clotting. And clotting involves fibrin or fibrinogen, depending on the active or inactive part that you're talking about. And what fibrin does, it forms a net. And this net ends up capturing cells that end up forming a mesh that causes the blood to stop. Now, there is some people who have hemophilia. Hemophilia, they miss factor VIII, which prevents this fibrin from actually forming correctly, and it makes their blood harder to clot, of course. So hemophilia is like the free bleeder, which we've mentioned already. And then sometimes you have mistakes occur where clots occur when you're not expecting them to. And that's called a thrombus, which would be like a clot inside of a blood vessel, and this could lead to a heart attack or a stroke if you didn't have something that would counteract that. Anyway, I hope this helps you a little bit with the circulatory system and respiratory system, and I will talk to you very, very soon.